Well, good morning, everyone. This morning, I've declared a state of emergency in the province of Ontario. We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19. The first order under this declaration will be the prohibition of organized public events of over 50 people, including parades and events and services within places of worship until March the 31st. Secondly, the following establishments are closed effective immediately until March the 31st. All facilities providing indoor recreational programs, all public libraries, all private schools as defined in the Education Act, all licensed child care centers, all bars and restaurants, except to the extent that such facilities provide takeout food and delivery. All theaters, including those offering live performances of music, dance, and other art forms, as well as cinemas that show movies and concert venues. Again, this order will come into effect immediately. I want to be very clear about what this means and what this doesn't mean. This is not a provincial shutdown. I repeat, this is not a provincial shutdown. The vast majority of businesses, including those most vital to day-to-day life, will not be affected by this order. Essential services and essential needs will be available to every individual and family. Groceries, convenience stores, pharmacies, manufacturing facilities, public transit, important public services, construction sites, office buildings will all continue to operate. Right now, we need to do everything possible to slow the spread of COVID-19 in order to avoid overwhelming our healthcare system. The health and well-being of every Ontarian must be our #1 priority. We must think about our children, our parents, and our grandparents. We must think about our neighbors, our colleagues, and our friends. We must think about the elderly, those with health issues, and every other person across this province. All of these people have been in my heart and on my mind with every decision I've made during this crisis. It is imperative we protect every person and every family across this province. We must act decisively, and we must not delay. As COVID-19 continues to spread, the government must be in a position to take any and all actions necessary. That is why today, Ontario has declared a state of emergency. As I've said all along, we've been preparing for every scenario. This decision was not made lightly. It was based on the advice of our Chief Medical Officer of Health and public health officials. Our cabinet deliberated late into the night and again very early this morning. As we take action to fight the spread of this virus, I want to assure the people of Ontario their government is taking every step possible to flatten the curve. We're taking the steps necessary to protect you and your loved ones. We're taking these measures now while our system is strong and to ensure it remains strong in the days and months ahead. I want to urge calm across the province. No expense will be spared to support Ontarians in need. There's no level of support we won't consider. By declaring a state of emergency, our province will be in the position to act as fast and decisively as needed. Again, this decision was not made lightly. We've seen around the world that jurisdictions like Ontario, who take timely and decisive action, have so far stayed ahead of this virus. We must flatten the curve and help stop the spread of COVID-19. We understand this decision will impact workers across this province. My message to these people is that we will support you during these difficult times. We expect the federal government to support Ontarians with the following measures. They must work with us to establish a loan program to support businesses. Immediate EI reforms must be implemented to support workers. The eligibility criteria must be expanded to include workers impacted by this outbreak. In Ontario, I've directed our cabinet to look at all options necessary to support the workers and businesses during this unprecedented time. That is why today I'm announcing the first stage of our COVID-19 emergency relief package. This is over $300 million committed to supporting the fight against COVID-19. This is the first stage of our larger emergency relief package. Our ministries have been working around the clock to develop a plan that can be implemented as fast as possible. This initial investment of $300 million for immediate measures to protect the health of Ontarians. This funding will also help us protect our seniors and the most vulnerable during this difficult time. We're going to bring 75 more critical beds online, 500 post-acute care beds, and help hospitals set up 25 more COVID-19 assessment centers. We're backing up our frontline public health workers with more resources for monitoring and testing. And we're purchasing more personal protective equipment like masks, gloves, surgical gowns for our nurses, doctors, and personal support workers, as well as more ventilators. For our long-term care homes, this funding will provide 24/7 health screening support for staff and visitors to help protect our seniors, as well as additional staffing for infection control and cleaning supplies at these homes. We're supporting our health professionals. We are providing funding to backfill 1,000 nurses, 1,000 personal support workers to support capacity during the outbreak. We're also providing funds for 50 physicians to cover emergency departments, urgent care, and primary care in Indigenous, northern, rural, and remote communities. We listen to the frontline workers, and this surge funding will back them up in the fight against COVID-19. In addition to the public health measures we've introduced today to keep everyone safe and healthy, and our legislation to provide job security to workers and families, and certainty to businesses. As I've said, we will spare no expense to support Ontarians. This is the first stage of a larger emergency relief package. In the coming days, Ontario will face challenging times. We must come together as a province. Every Ontarian must support each other. I and the entire government of Ontario will do whatever it takes to guide our province through this difficult time. For years, Ontarians have led the world in healthcare, research, business, and ingenuity. We have the greatest minds, the greatest businesses, and the greatest people in the entire world. Ontario will weather through this storm together. Ontario will come out of this stronger than ever before. Thank you, and God bless you.
Okay, we'll take questions now. We'll take questions from the floor first, and then we'll go to the phone line. One question, one follow-up.
Premier Ford, you say that you're doing this with the best medical advice, but was last Thursday you were saying schools would remain open, go on March break. Yesterday, your Chief Medical Officer of Health behind you, and he may want to answer this as well, was saying he was wary of going below 250 people, that bars and restaurants didn't need to close. Now we're at this stage. What's to say that the people of Ontario aren't right to panic, aren't right to think government and health authorities aren't ahead of this?
Well, I have all the confidence in the world in our Chief Medical Officer of Health, our Minister of Health, and our entire cabinet. This is changing hour by hour, day by day. And we're getting ahead of the curve. We're going to stop the spread, or at least slow down the spread, I should say, not stop the spread, slow down the spread. Because every region that has done this is getting ahead of COVID-19. When we do this, we can put more resources to our healthcare system. And that's the reason we need to do this and move as quickly as possible.
But why weren't you doing this ahead of time? What's to say you are getting the best medical advice? Because it took 4 hours yesterday for Dr. Williams to just switch from everything has to close, whereas earlier in the day it was stay open.
Well, I think I should let Dr. Williams answer that question.
Yes, when you asked yesterday, I said that we were in consultation with our federal counterparts, and we're across the country, each one reviewing and whether we would switch to the 50 from the 250. Our stance before was consistently across that. We did have input as the day went on that we were all going to move to that direction, and in concert with the Chief Public Health Officer of Canada. So again, as the Premier said, things have been changing, very fluid. We're trying to make sure we're in concert as best we can with our peers across the country to be consistent.
It's a question for Premier Ford. Yesterday when Trudeau announced the closure of the borders, he was heavily criticized for taking so long and dragging his feet in doing so. What is your message to, I guess, other provinces and regions that haven't gone to the extent that Ontario has at this point to do so, to follow in your footsteps?
Well, I'm in full communication with other premiers, and I just want to mention that every situation is different to every single province. I know the premiers well. They're going to make a decision based on the situation they're facing in their province.
With Ontario facing a deficit in the billions, how are you finding this $300 million? Where is that money coming from?
Well, again, I've said right from day one, we'll spare no expense because we've been prudent fiscal managers for the last 18 months. That's what is allowing us to spend the additional $300 million, but we can't do this alone. We need support from the federal government, and we'll make sure that we take care of businesses and people in this province, but we do need the support of the federal government. And when you're a prudent fiscal manager with the taxpayers' money, you always have to make sure that you have enough funds for the rainy day that comes along. And because of the great work that our Minister of Finance has been doing, along with Treasury, our Cabinet and caucus, we're able to have some funds when those rainy days happen.
Just to be clear, do you know what the split is between the federal government and the province?
Right now, if you want to answer that, Minister.
Sure. This it reflects the $200 million as well that the federal government provided, as well as the $100 million that we spoke about last week. Obviously, as I talked about yesterday in our statement next week, we're going to be looking at money in 3 buckets to support healthcare and other related government services, to support people, and also in areas where we need to support jobs in the economy. So those are the categories, and we're in regular communication with the federal government to discuss about how exactly we want to work in a coordinated way.
This question is for the Premier. You had just mentioned that this has been changing by the hour. So what was the turning point for you yesterday or this morning to decide to declare the state of emergency?
Well, the advice from the Chief Medical Officer of Health. We're following the experts the healthcare industry, following the advice of the Chief Medical Officer of Health, and that was based on that decision there.
And also, you had mentioned that, so any sort of gatherings of 50 plus more people, you're making mandatory that is not to happen, but yet you mentioned that, you know, office buildings could remain open. There are many businesses that have 50 plus or more staff, so why wouldn't this apply to that?
Well, first of all, it's critical we keep the supply chain going. Absolutely critical. We need our grocery stores open. We need the manufacturers of goods to continue manufacturing, to get the products in the stores. But it's absolutely critical that we keep the supply chain going.
Good morning, Mr. Premier. You had mentioned that every region that takes similar steps that Ontario is taking today have gotten ahead of the virus. So which regions are you talking about? What makes them a good model to follow?
Well, a large country, and you're seeing the job they're doing. I think they're doing a good job. Mind you, their numbers are a lot higher, would be Korea. You know, they're doing their best, like all of us, to get ahead of this and flatten the curve, slow the spread. And when we do that, put more resources, the $300 million, into frontline healthcare, support them. That's what we need to do to try to get ahead of this.
Good morning, Premier. I was wondering if you have any sense of how long this state of affairs will last, when you think Ontarians might be able to get back to their normal lives.
Well, we're doing everything we can, again, to slow the spread. And I'll be relying on the advice from the Chief Medical Officer of Health. That is our main goal. We don't want the spike. We want to flatten the curve, put more resources until we can handle any influx whatsoever. We have to be ready for every scenario, and that's what we're ready for.
Okay, and as a follow-up, it's not the Canadian way, as you mentioned, but are you prepared in case people do panic or, heaven forbid, there's looting?
Well, again, I have confidence in our police, and I just pray to God that wouldn't happen. We have incredible people. We have the smartest and brightest people in the world right here in Ontario. We need to stick together. We need to support each other. We need to look out for each other. If you have an elderly neighbor, take care of them. If you're going to the store, maybe ask them if you could pick up some groceries. But I have all the confidence in the people of Ontario. We're going to get through this together. We're going to work together, and we will get through this.
Hey, Jamie, we'll go to the phone line.
What additional powers, like the Prime Minister, what additional powers do you have, if any, and do you have to have does the House have to sit?
So we're sitting on Thursday with the cooperation of the NDP and the Liberals and the Green. Hopefully we'll get through that in one day. But I want to be very clear. We're doing this to make sure that the bars and gatherings of over 50 don't happen. We have to slow down the spread of COVID-19. And really that's why we're doing it, Jamie. That's the only way we can slow this down, and social distancing.
I understand. What happens to the bars that are open? Do you have any additional powers to force you to close, or anyone else that doesn't?
Well, be it by law officers or police officers, but we shouldn't have to do that, Jamie. There's so many great business owners, and in some cases, when they close the restaurants, close the bars, not all cases, but they'll have access to their insurance that they have on their businesses. But we need to work together. Let's work together. We'll get through this. And I think the responsible business owner will not open up.
Okay, we'll go to the phone line now. Again, one question, one follow-up.
Your first question comes from Victoria Gibson from iPolitics. Please go ahead.
Good morning. My question is for the Premier. With this new state of emergency, I'm wondering, would the province potentially be allowed to have out-of-province medical workers work here in Ontario without the respective college certification?
That was very hard to hear. I apologize. It's hard to hear on the line there. Maybe if someone could repeat that question. I think about taking medical professionals from other provinces.
Can you repeat the question?
Yeah. The question is for the Premier. With the state of emergency, can the province potentially allow out-of-province medical workers to work in Ontario without Ontario college certifications?
Well, I'll pass that over to the Minister of Health.
That's not something that we're contemplating right now. The purpose of the emergency order really is to allow for the closure of the facilities that are noted in the order, childcare, licensed childcare facilities, private schools, bars and restaurants. That's what we're really focusing on right now. It may be something that we might need to consider in the future, but for right now we're looking at limiting those kinds of activities to, as the Premier said, to flatten the curve and to prevent the spread of COVID-19.
Thank you. And in follow-up, will the declaration affect anything about supply? Will there be any limits on bulk buying that might be able to be enforced, for example?
No, it won't affect the supply chain.
Next question.
Your next question comes from Travis Donraj from Global News. Please go ahead.
Morning, Premier. Italy right now is having to decide who will live and who will die due to lack of respirators and hospital capacity. The evidence shows that if you order everyone to stay home, the case numbers, and when the case numbers are low, you reduce transmission and reduce overload at hospitals. Why are you not ordering everyone to stay home now as opposed to waiting to do that?
Well, Travis, we aren't in the same situation as Italy. And secondly, I'm taking the advice of medical professionals. And the Chief Medical Officer of Health has not required us to do that. We aren't at that stage. But again, every scenario could pop up. And as I've mentioned over and over again, this is changing hour by hour, day by day.
And just as a follow-up to the Health Minister, can you say with confidence that Ontario will have enough hospital capacity and enough respirators if there is a spike quickly in cases like we have seen in, say, Washington State or New York City, for example, or New York State, for example?
Yes, we do have a plan in place. It is evolving rapidly, and we have the ability now with the additional funds to be able to create more bed space. We have respirators on hand. We have ordered more, but certainly what we're doing today with the announcement of this order is, as I said, to try and flatten the curve so that we don't end up with vast numbers of people in hospitals requiring respirators. This is the purpose of the order, so that we can protect people and keep them healthy.
Next question.
The next question is from Allison Jones from the Canadian Press. Please go ahead.
Hi, Premier. I'm wondering if you can talk a little bit about what you see as the economic impact of this order to close restaurants and bars, et cetera.
Well, there's thousands of people that work in bars and restaurants, and that's why it's essential the federal government gets moving on the EI, instant EI for people that have been laid off. We're there to support them. Our government will be there to support them, and we'll be there to support businesses as well.
And just follow up, can you clarify if this order applies to shopping malls as well?
Well, I'm going to pass that over to the Chief Medical Officer of Health.
The aspect in there, we've looked at that to consider, and because it is retail stores separate, we're watching to see how that will happen. We have not actually closed malls at this time. We're going to be advised by that situation to see if that's necessary, but we will be advised by different directors and our healthcare people in that regard.
Next question.
Your next question is from Rob Ferguson from Toronto Star. Please go ahead.
Good morning, Premier. Just wondering, what was the tipping point to declare these emergency powers today on things that Dr. Williams simply recommended yesterday? Were you seeing signs that some businesses were not complying? So what happened there?
Well, again, based on the advice of our Chief Medical Officer, We sat down with Cabinet late last night and early this morning, had an extremely good discussion back and forth, and we decided that's the best thing to do to protect the people of Ontario, to slow down the spread, to flatten the curve, and make sure that we have the resources for our healthcare workers to do the job and give them the tools they need.
Okay. As a follow-up, with these emergency powers you're declaring today, what kind of other powers does this give you, and what would be the tipping point for using those? For example, can you tell people that perhaps you don't want anyone else coming into Toronto? Can you tell people that they shouldn't be flying or taking the train in the province or public transit? Can you and closing down businesses?
Rob, well, right now, we're just focused on making sure that, as the minister said, bars, places of worship, any place that people gather, restaurants, we just want to make sure that we have social distancing to the best of our ability. But again, we need cooperation from the public, and I think the public is well aware of the situation, and I'm proud the way they've been handling this, and I'm very, very grateful for the people of Ontario and the way they've been reacting so far. They again are our partners along with the federal government. Where we need the support, and I'm seeing it in these communities, we'll be there, Queen's Park will be there, the federal government will be there, but we need the people. We need the communities right across this province, all 444 municipalities, to be working with us and making sure that we, again, slow the spread of COVID-19.
Next question.
The next question is from Sabrina Nanji from Queen's Park Today. Please go ahead.
Oh, hi, Premier. I'm just wondering, you mentioned that you want to support businesses. Will the relief package include compensation for businesses that will be forced to close?
Well, we're working along with the federal government right now. Our first package, we're focusing the $300 million on health care. We're working on other packages that will support small businesses and businesses across this province. But right now, we want to focus on our healthcare workers.
And do you mind maybe elaborating a little bit on what type of support you'll be providing to businesses?
Well, right now, the Minister of Finance is working with his federal colleague, and I'm sure that's going to be coming over the next few days.
Next question.
The next question is from Christina Horan from City News. Please go ahead.
Hi, Premier. Good morning.
Hi,
I'm wondering if you're planning on changing the time of use right now for hydro rates, or if people can expect massive reductions in their hydro bills at this point.
Well, that's on the table. We had that discussion with the Minister of Energy with the time of use. I'll be very frank, I've never been in favor of that from day one, but the Minister of Energy is working on that, and we'll be talking about that over the next few days.
And then a follow-up now that might be better suited for Solicitor General Jones. What new measures are you planning on instituting in our correctional institutes? We're hearing a lot about a lack of PPE gear for staff there, but are you going to be stopping transfers? A lot of jail guards are saying that they simply don't feel like they are prepared for this sort of situation.
So I'm sure you caught the press release that we sent out Friday. We've already instituted a number of measures. Things like people who are serving weekend sentences no longer have to go into the institution. We have put a number of protections in place, and we'll continue to do that to ensure the safety of our corrections officers and the inmates who serve.
But are you planning on stopping transfers to different institutions?
So as a general rule, because of some of the changes that have happened with the Attorney General, the court transfers are very much limited. There are some transfers that are happening in terms of releases, but I want to assure you that we have put a number of measures in place already, and will continue to assess the situation to see what additional procedures that we can put in place to protect individuals.
Next question.
The next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hello, Premier, and everyone else there. So yesterday, the federal health minister confirmed that the coronavirus is spreading in the community. How many cases are being investigated as community spread in Ontario right now? And judging from other cities like Italy, what would the actual number be? Because we know there would be so many more that we don't even know about yet.
Thank you for the question. I'm going to ask Dr. Williams to please join me to discuss this situation with respect to community spread.
So we are aware of each of our different health units as they obtain information on cases with positive testing. They undertake an investigation to see if they have risk factors such as travel or contact with a case. If they can't identify that, there's a question if it's community-based. Then you have to do further investigation of the close contacts of that person to see did they get it from some other source. So it does take more time to do that. So the ones that are not definitely addressed with risk factors are assumed it could be community, but it doesn't mean it's ruled out yet. Toronto has some of the other health units have one or two, and they're following up on those at this time. But the majority of our cases have been related to travel or with contact of cases.
Okay, but how many in total? As a follow-up, how many cases in total? You said Toronto has some. I believe the number yesterday was 3. How many in total do you believe are community spread, and therefore is the potential for that number to be far greater?
I haven't got the numbers yet for today. It changes day by day as they work through their investigations. Some are removed off and risk factors are identified. So we'll have to see what that total, including new cases being added every day, and more of them to be followed up on. So it's a fluid number in there, and I am very proud of the work that they're doing to manage that very well and to keep that number down and to try and identify any risk factors or if there's any clustering that they would follow up on as appropriate to their protocols.
Okay, are you concerned that the spread is far greater than we realize?
The methods we've done with our sentinel surveillance, we were concerned before to say, are we missing any? And so therefore, any case that we've seen in our long-term care facilities of outbreak of respiratory or in our hospitals and emergency departments that are admitted for respiratory problems, we've done parallel testing. We've done nearly well over just about 2,000 tests, and they've all been negative so far. So if we were sensing a lot of that, we would start to see some of those showing evidence of that. So far, we've been reassured by that, but it doesn't mean we're going to be complacent on that.
Okay, we have time for 2 more. Next question.
The next question is a follow-up from Travis Dunrush of Global News. Please go ahead.
Hi there, Premier. This actually is a question for the health minister. Minister Elliott, yesterday BC's health minister didn't hold back, saying that he thought it was a mistake to close the border to every other country in the world other than the United States due to the outbreak that we are seeing there. I'm wondering if you can weigh in and whether or not you think it's a misstep not to close that border more quickly to reduce the amount of transmission coming from the United States.
Well, I can't really comment specifically on that because that's another decision that was made, but we are dealing with that. We are trying to make the best decisions for Ontario right now, which is why we've brought forward this emergency order, because it really is necessary to flatten the spread of COVID-19, and we want to make sure that to the extent possible with mass gatherings that they not be held so that we can stop the spread of this virus and keep people safe and keep our hospitals from becoming overwhelmed.
Okay,
and to Dr. Williams, I just have a clarification on my earlier question. Premier said that we're not at the point yet where they need to have a province-wide shutdown. At what point do you make that decision? Is there a case number that we have to reach? What's the threshold there before you recommend that?
Well, in our approach here in Ontario, we have continually emphasized that people coming forward and participating and taking part in this response has demonstrated the effectiveness of the Ontario program. Ontarians are concerned. They continue to do what they need to do, and they're taking action. And the information is that when you add social distancing protocols with your control mechanisms, your containment, the key thing is public participation. I think we have that in Ontario. We have people who are dedicated to that. They want to take part in that. And so I have confidence at this time that we don't need those kind of aspects, because things that people do on their own volition, but dedication, as the Premier said, helping each other to manage the situation, because it is a collective action. And we can do this, and we can keep flattening the curve on COVID-19 and on that aspect there. So I really emphasize the participation ongoing of our Ontario citizens.
Okay, one last question from Antonella.
We're getting very worried emails from people like artists, the self-employed, people who have small shops like hairdressers who need that monthly income to meet all their expenses. I know you can't provide perhaps every detail right now, but can you assure that these people, they're not being forgotten in this, that these sort of small employers, independent artists will be covered in whatever protection measures or supports you offer?
We will, with conjunction with the federal government. Again, it's absolutely critical we partner with the federal government, especially the self-employed, that EI is not available for them. And I just want to mention we won't forget those people. We aren't going to forget anyone. We're going to spare no expense to take care of the people's health and personally their businesses across this province, with the support, I emphasize, with the support of the federal government. Thank you, everyone.
Thank you.
Thank you. Appreciate it.